Side bending is a rather complex movement that's analysed very often for function, for balance, and for clinical assessments for things like back problems and hip problems. The way it's normally assessed is the distance the hand reaches down to the floor, which is done quite nicely on this side to the left, but as you can see, not the same way on the right. So sometimes you don't quite get an accurate picture of somebody's side bending just because of the way they used the arm. So in Qinematic, we use the shoulders, we use the hips, we use the fingertips, and we observe the rest of the body parts, including the center of mass. We can see what strategies people use for moving sideways. Is it a hip strategy, a shoulder strategy, a head strategy? And by looking at the way people move and quantifying various body parts, you can explain why they lose balance, why they prefer one side instead of the other, or even the effect that golfers had on them over many years of playing golf one-sided. Side bending should also be looked at from the side, because it's not always that people perform a side bend in one plane. They often rotate. Also from the top, they might reach backwards, they might reach forwards. And this can affect the way the joints move in the spine, or how the person loads the hips and the knees and the feet. Measuring this individual's side bending shows that the fingertips actually reach a very similar height. If anything, this person, even though the arm goes out, reaches more or less the same as the left-hand side. The same can be said for the distance that the shoulders travel. This is indeed the vertical distance from the start to the end position of the tip of the shoulder. It is not the exact distance that the shoulder travels, it is the vertical distance travelled. The same can be said for the fingertips. It is the vertical distance travelled, it is not the path that the hand travels. When the side bend is captured in 3D video and quantified in measurements, we can see some very interesting information. This is the basic frontal view information. As we said, they look very similar left and right, but if you look at the way the body behaves, specifically the center of mass or the path of the center of mass to the left compared to the right, one can see that it's very different. If we look at the contribution of the hips, this person is very still in their hips, the blue line, and the green line is the contribution of the chest. Two different body parts that can contribute to side bending. This person doesn't successfully finish their side bend before the recording time is up. So in actual fact, they start in flexion and go into extension, and then the testing period ends approximately here. If we were to look at the hips, we can see that the hips move to the left as this person bends to the right, and the hips move 2.5 centimeters. The chest moves 29 centimeters to the right as the person bends to the right. When we bend to the left, the hips also move to the left, which is rather different to bending to the right where the hips moved to the opposite side. So in this case, when the person bends to the left, the hips move to the same side. In this case, when the person bends to the right, the hips move to the opposite side. So they have two very different hip strategies. And this can explain the differences in the quality of movement. The chest moves to the left as they bend to the left, but not as much on the other side. Here we have 26.7 and here we have 29.4. So there's approximately a 10% difference there between the two sides. Not just the quality of movement, but the magnitude of movement of the chest. This individual bends far more to the left than they do to the right, and it appears because they go into flexion to the left and extension to the right. Flexion typically allows more lateral flexion and extension less, just because of the shape of the joints in the lumbar spine. The distance reached is more, so it comes to 47 centimeters above the ground compared to 52. When we look in the movement laboratory at the quality of movement here, it's quite clear from the front how the person looks, but probably more obvious from the side. So to the left into flexion and to the right into extension. Flexion to the left, extension to the right. The biomechanics report makes this very clear with metrics and graphs. So bending to the left, you can see initial flexion, coming back, slight extension and back along the same path. Bending to the right, very clear extension out one path and back along the same path. In this case, there's not a lot of hip movement, or at least it's going along the axis with a bit of a difference here at the end. So if we look at the hips going to the left, they move 2.5 centimeters, and the hips moving to the right 1.5 centimeters. This person basically avoids moving their hips and concentrates on moving the chest. Chest on the left moves 21 centimeters and chest on the right moves sideways, also close to 21 centimeters. So in actual fact, the size of the movement is quite similar at the hips and the chest, but the quality is very different. One goes into flexion to the left and one goes into extension to the right. We have an example of somebody with curvature of the spine, and very often side bending is limited to one side, if not two. So in this case, this person cannot bend to the left so far, bends reasonably to the right hand side. Center of mass doesn't move so much to the left, but moves quite nicely to the right hand side. The biomechanics report shows quite clearly how little movement in the center of mass occurs on the left, and quite nice movement on the right, even though the person doesn't go out and back on the same path. So the hips moving to the left also move to the left 1 centimeter. That's to try and facilitate the range of motion. And as it appears with this person, when they bend to the right, they also bend their hips to the right. Much more chest movement, 22 centimeters. To the left, very little movement, 6 centimeters. So 5.8 centimeters downwards and 6.4 centimeters sideways. In this case, 20 centimeters downwards and 23 centimeters sideways. If somebody like this was getting some training, some treatment, some stretching, some type of intervention, massage that was to help them with this limited range of motion, you would be looking for changes in these numbers over time. We have an example of a fairly normal side bend, very similar distances reached by the hands to the distance observed at the shoulders. Bit of lower back and thoracic spine on both sides. quite possibly a little bit more lower back movement here by this distance increasing, and maybe a little bit more chest and less lower back to the left. It's very difficult to see the behavior of the pelvis here in real time, but once we look at the biomechanics report, we may be able to see the numbers. The biomechanics report shows that the pattern travelled by the centre of mass is reasonably similar to the left, to the right. The right tends to be more lateral. The left is a little bit more forwards and backwards, or flexion and extension. The contribution of the hips seems close. Bending to the right, the hips move to the left. Bending to the left, the hips move to the right. 3.6 centimeters when bending to the left, and 4.1 when bending to the right, so they are indeed very similar. The same can be said for movement of the chest. When bending to the right, the chest moves laterally 20 centimeters, and when bending to the right, it moves 18 centimeters, and these would be considered very similar indeed. So asymmetrical side bend with very little contribution from the hips, most of the movement coming from the trunk. Side bend with considerable amount of hip strategy on the left and the right side, but a much bigger movement to the left than there is to the right. So once again, when bending to the right hand, the hips move a lot. When bending with the left hand, not so much. There is a 3 centimeter difference between reaching left and right. So reaching to the right appears to have more movement from the shoulder, and that probably is because of their greater hip movement. And therefore, there is a large difference reached by the hands, up to 6 centimeters. It could be that this was much more chesty and therefore didn't reach as far, whereas this is more whole body and therefore reaches much further. When looking at the biomechanics report, it becomes very clear how the body behaves. So bending to the left-hand side, we see that there's not so much movement at the center of mass. And when bending to the right-hand side, we can see that there is a considerable movement of the center of mass. If we look at the participation of the hips, when bending to the left, the hips really are moving to the right, around about 10 centimeters if we look at the data here. And when bending to the right, they're nearly double that, 20 centimeters, which is considerable. The contribution of the chest is in fact very similar at 6.5 to 7 centimeters on both sides. So the main factor here, and that was quite obvious in the movement, is the contribution of the hips. Here we have side bending to the left and to the right. Bending to the right seems quite restricted. Bending to the left is better, but still not so long. At 14 centimeters compared to 10 centimeters. This would be typical of somebody who's quite stiff in their lumbar spine and really is only using the chest to reach to the side. Hence we see quite poor side bending or reaching distance here, and an 8 centimeter difference, which is quite a lot. Bending to the left hand side, you see the center of mass traveling a little bit further compared to the right. And again, it's going sideways and slightly forwards, whereas bending to the right, it's going sideways and backwards. So they are in fact different in terms of the quality of movement when you look at the movement at the center of the mass. The hips move 3.7 centimeters to the right when bending to the left, so they actually move in the opposite direction. And when bending to the right, the hips move 3 centimeters. So not a lot of difference there. In fact, the hips were relatively still in this person. The chest, on the other hand, bending to the left, moves a lot further at 20 centimeters laterally and 14 centimeters vertically. Bending to the right, 10 centimeters vertically and just 12 centimeters laterally. So the bending performance is much better to the left than it is to the right. And this, of course, could be a restriction in the joints, it could be muscle tightness, it could be pain avoidance. There are many, many explanations that would benefit from a deeper investigation.